So first, I'll just sort of give a soft introduction. Ryan Price, American Foundation for Suicide Prevention. He's got quite a compelling story, which I want him to tell in just a minute. And then next to Ryan is Nicole Hockley, the co-founder of the Sandy Hook Promise program. And so, again, both of you have very important stories to tell. So I'll get to asking some questions in a minute, but first maybe, Ryan, if you don't mind, would you be happy to talk about your background and a little bit about what you do at the foundation?
Yes, thank you, and I'm so glad you're here today. I'm the Director of Special Projects at the American Foundation for Suicide Prevention, and that means a lot of things, but mostly I focus on firearm suicide prevention in correction settings, and now more recently, supporting staff and developing a program for veteran suicide prevention, and there's a lot of crossover in all of those areas. So we've got my contact information is up on the screen. I've also got a handful of cards if you'd like to get in touch. And I've been at AFSP for 9 years in various different roles, and I found myself drawn to, I wouldn't say it's compelling, but lucky in a way, having the chance to work on firearm suicide prevention. I spent about 5 years working in a firearms retail setting where I wasn't a gun owner to start with. And it was a really interesting experience to learn about how the process of selling a firearm, to learn about the character and the importance of firearms to some gun owners, where it's really, in some ways, for many people, it's an extension of their identity. And so there have been many well-intentioned efforts to reduce firearm suicide or to curb gun violence, which seem good on the surface, but for many are perceived as an attack on their own identity. And so I'm really fortunate to be able to work on this. And on the next slide, I have just 2 really brief slides to share, and I hope that you'll ask questions. We don't have a lot of talking points prepared, but on this, I guess I can advance it to you. On this next slide, I want to just talk a little bit about the perception versus the reality related to firearms suicide. And, I'm going to use a really clumsy example, but if you imagined growing up as an adult and you didn't know how electricity worked, and then something got stuck in an electrical outlet, and you just grabbed a fork and tried to pry it out, you're going to be really surprised, because you didn't know how electricity works and what the consequences of that's going to be. And often with firearm suicide, we're in the situation where many people that own firearms are just not aware, and it's not for any, ignorance or lack of preparation or anything like that. It's just a conversation, much like our country, that we just haven't really started to have yet. And so I'm going to share some data. In Colorado, this is fairly recent. It's the Firearm Injury Prevention Institute. They're initiated a survey that they're doing across the state of Colorado every 2 years. And when they asked Coloradans about firearm, the leading causes of death for firearms, most people in Colorado believe that that homicide is the leading cause of firearm deaths. When the opposite is true, it's actually suicide, and over 78% of gun deaths in Colorado are suicides. So if you're a firearm owner in Colorado, how would you know about the steps you need to take, the warning signs to look for related to protecting yourself and your family, your community from suicide, if you believe that that's not as important or not as a leading cause of a death as homicide is? And also nationally, this was mentioned earlier, you can find more information about this at suicidepreventionnow.org, but the American Foundation for Suicide Prevention, along with the Action Alliance and the SPRC, conduct a Harris poll. And so this is representative across the United States. And only 49% of people in the U.S. know that limiting access to lethal means can be a life-saving measure. And so if you don't know, if you don't believe that, if you've never heard it before, why would you take steps to limit access to lethal means, to store firearms securely, to lock medications? You wouldn't, because you don't know it, you're not aware that it's going to actually make a difference. And also, similar in Colorado across the country, only 47% of people in the United States are aware of just how many gun deaths are suicides. In the most recent data, that we have. The Johns Hopkins University had a quote, and this is provisional still, but they said, gun suicides reach an all-time high. And it's provisional data, but it indicates to us that there's so many things that we can still do. And I like to focus on the hope that we have for the future. And so there's a couple of things I'd like to share that the American Foundation for Suicide Prevention has going on and is working on. And one of the ways that we work to prevent suicide is through education, and in firearms in particular, we collaborate with the National Shooting Sports Foundation and other organizations. And one thing we're doing now is launching a toolkit for firearms instructors, so that those that teach courses like basic pistol or basic shotgun, things like that, could voluntarily incorporate suicide prevention, knowing that it's from a trusted source. It'll be free. We're pilot testing it now. We also changed the way that our main education program is delivered, in that it's an hour-long program. It's similar to QPR, but it's called Talk Saves Lives. It goes over, and it's an introduction to suicide prevention. And now we include information about secure firearm storage in that presentation, because there are, about 40% of households in the United States have firearms in them. So if you're doing programs in your community, at your hospitals, within your counties, or within your states, I would just encourage you to find ways to incorporate lethal means conversations, secure firearm storage into those, because most people believe that they would do something. Most people believe that they would help someone if they knew what to do, and that's again from this Harris poll study. And there's also hope in the form of legislation, and this can be a challenge. I know here in Wyoming, but in Montana in the 2023 session, there was a bipartisan bill that passed unanimously that improved the ability for firearm owners to store their firearms securely out of home, in a way that it works with the federal firearms license holders, so that they don't have to necessarily worry about the liability of what's going to happen. So there's hope for the future, and I'm just so glad to be here for this conversation, and so I'll hand this over to Nicole.
Thanks, Ryan, and thanks, Kurt. Hello, everyone. My name is Nicole Hockley, and I guess I'm serving a dual purpose here, really. Part of me, I come to you as a mom of two boys, and to use the words of Tracy earlier, I guess I'm a lost survivor. Both of my boys were at Sandy Hook Elementary School on 12/14/2012. My eldest, Jake, was in 3rd grade, and my youngest, Dylan, was in 1st grade, when a disturbed young man came in and shot his way through the locked door and used his AR-15 to fire 154 rounds in less than 5 minutes. My 3rd grader, Jake, survived. He's now 20 and in his 3rd year of college, and he's awesome. But my 1st grader, Dylan, was shot 5 times and died in the arms of his special education assistant teacher, who also died while trying to protect him. And I'm forever changed as a result of that. Almost 12 years out, I'm probably as close now to the person I was before then as I'm ever going to be, but I also recognize I'm never going to be that person again. But I am the sort of person that needs to do something. So 1 month after the shooting, which possibly was a little too soon and a little silly on my behalf, but I launched an organization that's now called Sandy Hook Promise. And over the last 12 years, we're having a tremendous impact. So that's the second role that I come here as, not just as a mom, but as an advocate committed for change, very much focused on young people and their needs, and creating generational change around how do we create connection, how do we ensure that every child is seen, heard, valued, has trusted connections, has the ability to unlock those tools already inside of them of how do we create connection that reduces isolation. How do we recognize the warning signs when someone needs help for whatever reason? And how do we get them the help they need, either by talking to a trusted adult or by using something like an anonymous reporting system or other sort of crisis line? And we also are very focused on writing and passing legislation at both the state and federal level to fund school safety and mental health and gun violence prevention efforts, as well as help bring people together. And A lot of people will have assumptions about Sandy Hook Promise, and I totally recognize that. People think we're just a school shooting organization. Untrue. People think we're a gun control organization. Also untrue. People think we're just a white organization serving white people. Very untrue. What we are is a learning organization that is focused on doing whatever we can to keep kids safe. Gun violence is the #1 killer of kids between the ages of 0 and 19. Suicide is the second killer. And we look at all the pathways to violence that affect children on that escalating spectrum of violence, from bullying and isolation at one end, through to substance abuse, through to self-harm and cutting, dating violence, all the way through to its other extreme of suicide and homicide. So I'm just going to share, and because I can't see the screen from there, I've got some numbers here as I go to a slide. I pressed green. There we go. So one of the things that we do, in addition to focus very much on upstream violence prevention, like long before someone ever picks up a weapon to hurt themselves or someone else, how do we recognize when someone needs help? But one of our intervention methods is our anonymous reporting system. We have a program called Say Something. All of our programs are provided at no cost to schools across the country. And the Say Something program teaches what do these warning signs look like in your peers, and how do you get them help. We also have an anonymous reporting system so that if a person doesn't have a trusted adult, they can use the app, website, or hotline to reach out to a trained crisis counselor 24/7, 365, and build that relationship with them, share, this is what I'm seeing, this is what I'm hearing, this is what they posted, this is what I'm afraid of, and our crisis counselors triage the tip, work with school teams or local law enforcement, depending on the severity of the tip, or a mobile crisis team, and get the intervention. As of this past year, that anonymous reporting system serves around 7 million kids across the country at the moment, and in the last 6 years since we launched has had close to 280,000 tips from across the country. We also have some state partners: North Carolina, Pennsylvania, Washington State, and as of this year, Wyoming. So the Safe to Tell program, which is for students to anonymously report tips, those tips go into our crisis center in Miami, and we triage them and work with the schools teams. So to just give you a little bit of the data, as you can see here, this year, excluding our state partner, Pennsylvania, we've had about 40,000 tips into the anonymous reporting system. Only about 1,800 of those tips come from students in Wyoming. We have some hypotheses on why the tips are so much lower than what we're seeing in a lot of our other state partners, and we think it has to do with training. A lot of the research that we've done and peer-reviewed research shows that the training is super important, because without that, you're not going to know how to use the system. But on this chart on the left, you'll see that compared to the national tips, about twice the percentage of tips coming from Wyoming Safe to Tell involve weapons, of which around 70% of those are specifically firearms. And that almost 2 times the percentage of tips are coming in about suicide. So this is young people reporting, not self-reporting, but reporting, I'm concerned about my friend. They're talking about hurting themselves. What can I do? So it's definitely higher, as you've already seen in so many of the presentations earlier today, that this is a significant problem for frontier states and for Wyoming. And there's a lot of matching across what we see nationally trending for tips from young people compared to Wyoming. Bullying's the #1, harassment's the #2, but in Wyoming, suicide's #3, whereas nationally, suicide tends to be the 5th most reported tip. So there's still a lot of work to do in terms of how do we help young people who are ideating, who are concerned about their friends, and how do we get them the help that they need. So there's a lot there that we can do. And just moving forward so that we can then get into the conversation, this is a little bit about the approach of how Sandy Hook Promise has taken things across the country, and where we would, by invitation, love to be of more support here in Wyoming or the frontier states in general. We do very much focus on upstream violence prevention. We do focus on pathways to violence and escalation. And we train young people and the adults around them what it looks like to need help, so that you can recognize what that is. I mean, you think back to, other health approaches to what does a heart attack really look like, or what does drowning look like. It's not the way it looks in the movies. It's much more peaceful and quiet, but it's a killer. And if we don't, or strokes, once we recognize what these signs are, we can create more interventions. And that has nothing to do with the firearm per se. That is just about helping each other. So we train these kids and the adults around them what that looks like. We train adults, what does it mean to be a trusted adult? And what's your responsibility? If a child comes to you and says, I need help, or my friend needs help, what do you do? And then we follow it through in terms of dispositions, referrals. We never want to leave anyone hanging because young people are far too important for that. We also have a specific arm out of our Say Something program that is focused on prevent suicide and specifically around signs of suicide ideation and how we create more connection with people so that they can get the help that they need. And we also we are starting to work in postvention and recovery purely because it's something that people have been coming to us for help with for the last 12 years. And while we do a lot of that work privately, we do want to have a consistent playbook of support based in evidence. And everything that we do is research-based and evidence-informed at the moment, and we're writing the playbook on research for things like anonymous reporting systems. And we also focus on state and federal policies. Some of the ones you kind of already heard mentioned with Kurt in terms of temporary transfer. We're very active in Kentucky in particular, and Tennessee, and next year Wisconsin. We also focus a lot on secure storage. We wrote a bill called Keep Every Home Safe Act, which is, I believe it's passed in Ohio or is about to pass in Ohio. And we're focusing on Nevada next year. Federally, in terms of secure storage, we wrote an act called the Kid Proof Act, which is very, very similar to what you talked about in Utah, which is healthcare professionals. When a family comes and has a child at risk, it is the ability, federally funded program, to provide a storage unit to that family so that they can store their lethal means. But this is where it gets tricky, because as soon as you mention the word gun, there's an overlay of politics here, which it just shouldn't be. Because if that is one of the means that is being used for people to take their own lives, then it's something that we need to talk about and address. And it is very discouraging at a federal level to have a conversation with a senator, for example, who'll be like, Kid Proof Act is awesome, absolutely support, because it's about opioid storage, right? And I'll be quite honest and say, if that's what you want it to be, that's what we'll talk about. And you'll say, well, that's the #1 killer of kids, right? No. Well, what's that? Well, you said we're not going to talk about firearms, so we're not going to have that conversation. But if you exclude the word firearm from this legislation, then healthcare professionals might feel that they're not allowed to talk about that. So let the healthcare provider work with the family unit to determine what's right. But don't exclude the word firearm just because of politics, when this is how people are taking their lives. And the vast majority of people impacted by gun violence are firearm owners. So let's embrace that and work with it instead of try to ignore it and pretend it's something that it's not. So that's our approach. I went on a little bit too long, I apologize. But we're very invested, and we really want to just be helpful. That's all we want to do, is be helpful. So.
Thank you both very much. So Nicole, if I could just zero in on something you just said in terms of that sort of reaction to the word firearm or signaling confiscation, for example, what would be your proposed solve for that from a policy or legislative standpoint? What might work?
Well, kind of if I had the answer to that, I probably wouldn't be sitting here right now. But I do think it's about having authentic conversations and not trying to hide things. I do believe that, in traveling around the country, there is no one that's pro-gun violence. There is no one that's pro-suicide. So let's focus on those common platforms of what we agree on. We agree that we want to keep people safe. We want to keep veterans safe. We want to keep kids safe. So let's discuss where we can agree and not agree and focus on the areas that we agree on. And I've had a lot of very productive conversations with parents that are gun owners, as well as politicians that are gun owners or who have constituents who are gun owners. And things like secure storage are not, are generally agreed on. Sometimes the implementation can be a little misunderstood. Temporary transfer or extreme risk protection orders, generally speaking, are something that we all agree on. It's the implementation that we might get a little stuck on. Or even things like background checks, which in Texas we call stranger to stranger, because having a conversation with a gun owner, it would be like, are you comfortable giving a gun to a stranger? No. So let's have a conversation about that. So a lot of it for me, I think, is in the framing and the messaging and recognizing the values of why someone has a gun,
Right.
and talk about that. And also from a young person or from that owner perspective, what does safety mean to you, and what is it going to take to feel safe? So for me, it's all around the messaging and the framing more than anything else.
Well, and language too. So I guess I'm wondering for both of you, this is a question for both of you then. I know that in the circles that I work in, there's often this siloed event when you work with traditional gun violence prevention models, and then suicide prevention sort of are viewed as separate things. And I don't know whether you both have an opinion on this, but I am curious. Do you think it's helpful to say words like gun violence? Does that have an impact? And if so, is it good or is it not so good? Is my question.
Great question. And I do think gun violence can be misleading, because most people don't think of suicide as gun violence. And as we all know, it's 2/3 of all gun deaths. It can also be the one, unfortunately, that triggers the most reaction. Even though school shootings, for example, are a tiny sliver of firearm violence. If you look at things like Pew Research, over 1/3 of parents are afraid of a school shooting happening in their kid's school. So I'm not saying that we should use fear to create action, but it's, again, meeting people, where are they emotionally at the moment, and does that spur them, like when you gave the example of speaking to the gun owner and suddenly realizing that that could be used to harm his child, that changed his behavior.
Right.
So I do think it's about understanding the motivations and working within that. Gun violence can be misleading for sure, because people don't think about it as suicide. And for, unfortunately, in my experience, too many people, suicide prevention doesn't elicit the same reaction. It should, but it doesn't.
Thank you. Ryan, did you want to add something?
I've experienced that it leads to the sort of lack of awareness or understanding among firearm owners, who can have a belief that, you know, they're protecting themselves from something, and if you're not aware of the other risks potentially, how could you protect against that? And so lumping them together, it's a governmental thing, it's the CDC, and it's how they've chosen to measure it, but it doesn't tell the whole story, because it can also be used in ways that are alienating to firearm owners, by saying there were 50,000 gun deaths in a year, and not clarifying that there are distinctions, that suicide is different than homicide. There's some distinctness between the two, and I think it has led to this lack of overall understanding and awareness about the impacts of suicide and firearms.
Right. Yeah, I mean, I think the thing that resonates for me is just how we align on one particular issue, which is the sheer loss of it, losing someone to premature death. I also wonder if the term violence allows us sort of some sense of othering the events, where it doesn't feel like it's that close to us, when I think maybe being more deliberately humanizing around the grief and loss of losing loved ones might be a way to center that. Any reactions to that idea?
Yes, and it's funny when Ryan, it's not funny, I use that word far too much and none of this is funny, so I apologize for that. When Ryan was just speaking about, the government terms, and I completely agree, and when the attorney, when they recently declared, gun violence as a public health epidemic, it's a suicide epidemic. When you really get down to it.
Right.
And I think that we should be much more explicit on that. And I also, saw some startling facts around that same time, which were startling but also very unsurprising about the number of people that have been touched by suicide or gun violence. And that it was more than half of the country, if I recall from the numbers. So I think centering on that effect on our overall well-being. I mean, obviously there's an economic effect as well, if we want to talk to government around that. There's the ongoing mental health and trauma effect that affects long-term life for anyone who has been around any form of suicide or gun violence. That exposure to violence, that's trauma that continues to build. You get into ACEs and all of that sort of stuff. It's an ongoing cycle that in centering the experience of people, especially young people, and what that does to the trajectory of their life and what their expectations are, I think that's something that we could be focused more on.
Nice. I just want to say, it just occurred to me about something that when I used to work a lot in schools more directly, I was often asked to be the evaluator of either violence risk assessment and separately, but not necessarily, suicide risk assessment. And there's often this attempt to kind of bifurcate that. And what I've learned in my work talking directly to kids is that kids who become in some ways homicidal are almost always suicidal.
Correct.
Yet the reverse is not true.
Correct.
So I guess what I would say is the risk factors, the contributing factors that lead to increased risk for death, whether towards others or self, are often similar. And we don't like to think about it that way because it feels like it should be separate. But I would argue, kind of like what we're talking about now, that it's not necessarily separate.
No, they're not separate. And when you think about ACEs and everything else, or a lot of the interviews and research that have happened with mass shooters, for example,
Right.
More often than not, suicidal.
Right.
And as one of my colleagues, Dr. Jillian Peterson, always says, the worse the story, the worse the crime. So there's a lot there to be thinking about, and I think that comes straight back to when we know someone has trauma and is in crisis, it has nothing to do with the Constitution about temporarily ensuring that they can't access means to carry through on what they're feeling in that moment.
Right. And I think if we can do a better job of humanizing this process, I think we'll do a better job. So I know that I had some other questions planned, and sometimes the best laid plans have to be put aside. But I do want to ask both of you, in terms of some of the barriers and challenges to the work, especially given the recent or soon to happen change in administration. I was reminded earlier today about the fact that there's a pivot from, let's say, school mental health to school safety, hardening the targets, et cetera. Can you sort of anticipate or think about how you'll respond to what could be a different climate funding-wise, people not having as much motivation to sort of support mental health? What do you anticipate, and do you have any thoughts about the way you might navigate around those challenges that we're soon to experience?
I can say, I'm going to give you a non-answer, Kurt, because we have a policy office in DC, and I know prior to the election, we had a plan for one candidate and a similar plan for another. For one candidate, it was going to be asking for more money for this particular program, which I'm not going to try and remember the name of. For the other candidate, it was going to be reminding them that he started the program, so please leave it. And so they're the experts in the policy space. And I think what's important, though, is to recognize that in some ways policy can have a role, because it doesn't have to be limiting. It doesn't have to be, one versus the other. There are places that we can come together to drive funding for programs that we know are effective, that we can agree are effective, to listen to the other side. And I think that's the most important thing.
Thank you.
I think I would add to that. So it is possible to pass policy, and I know because we've done it with whoever's in office. So, we've passed legislation under the Obama administration, wrote and passed the Stop School Violence Act under the Trump administration the first time, the Stand Up Act and Bipartisan Safer Communities Act with Biden administration. I think for me, it's keeping the balance. You mentioned hardening earlier. There is a knee-jerk reaction here across the country in many schools that are focused on, well, if I have better metal detectors or door locks or whatever, technology to recognize guns coming through, that I'll have a safer school. Not really, because metal detectors don't always work, as we know. The technology doesn't always work, and more often than not, your shooter's already inside the school because it's a student. So it requires more focus on helping kids and mental health counselors and upstream violence prevention to get them help. And I think there's still a lot of opportunity in the states for focusing on legislation and funding. It's definitely going to be trickier over the next 4 years, but not impossible. And sadly, the last Trump administration, there were more mass shootings in those 4 years than any other time. And the administration responded in a way. So I still believe people give a shit, and want to make a difference and care. So I will always try to find the opportunity wherever. But I also am very focused on the young people, because this isn't about policy change per se. It's around behavioral change. How do we learn to help each other? Kids innately want to support each other. Sometimes we adults taint them with our beliefs. And I think, letting kids be kids and teaching them how to grow up as upstanders. I mean, this is the generation that has grown up with lockdown drills and active shooter drills. So I think they're also the generation that's going to create that long-term change. So administrations change, behavior can change and be sustained much longer than any political administration.
Thank you both. And did you want to add something?
There's something that we didn't put in the slides, and I think it's important to talk about, which is that the rates of youth suicide are lower than adults, and we have some suspicions on why that is. I don't think we know for sure, but one of the reasons is they tend to use less lethal means. And most people who survive a suicide attempt don't go on to die by suicide, yet when a firearm is involved, most people don't get that chance. And so when it comes to this conversation about firearms and youth suicide, if the way that we frame it to help firearm owners, families, households with children to understand and incorporate secure storage into and talk about suicide prevention, talk about mental health, because our last panel with thinking about education, it's to prepare you for the future. And if we can raise up generations which understand the firearm safety concepts that are already embedded for the vast majority of firearm owning households, to include mental health and suicide prevention, long term, it's a viable strategy to reduce the rate long term. It's not just like this year, it is that. but it's also imagine what we could do in the future if kids who grow up in households with guns understand how to keep themselves safe from suicide, how and when to get help for their mental health, how and when to help their friends and family when they might be at risk for suicide. We will have accomplished an amazing feat and changed the trajectory of suicide, I think.
Thank you, Ryan. And there's really no time to waste, because I think the data that I was showing earlier about the psychological accessibility of firearms, the average age of that becoming true is getting younger and younger. So as much as there was a huge gap between males and females in terms of a method of attempt, those patterns are beginning to shift. And so we have no time to waste. I want to say one more thing, and then we're going to turn it over to the audience. I know that when I was listening to Nicole a minute ago, and also Ryan earlier, words really matter. I think one of the hopeful things that I'm wanting to point out to you is when the legislation was drafted to create educative interventions in the state of Utah around secure storage, they made a single word change that I thought was pretty impactful that I think penetrated through this assumption around suicide that was very important. So instead of saying reducing access to lethal means, the legislative attorney in the state of Utah changed that word to fatal. And for some reason, I don't know, I don't have this on good authority, but it's my belief that that term resonated with the folks in the state of Utah, where the law passed, I think, virtually unanimously, and it's now in the books. And so I think words matter. So I know that we have some time for some questions. I think we have another, 8 minutes or so? Did I have that about right? So I'd love to hear from folks, ask questions directly to Nicole, to Ryan, if you have them.
Okay. Hi, it's Faith again. I have lots of questions. Our organization has done suicide prevention, and this year we did an event that specifically focused on the construction industry, and we were there with gun locks, and people were more willing to engage with us than I thought they would be. But the one thing I heard from the people that took the gun locks was, oh, this is to protect my child, or I have kids, or there are strangers. And I think, it is hard to imagine yourself as the one that needs protecting from. So I'm wondering if, in your expert opinions, would you exploit that and say, oh yeah, this is for other people? Or is it important that we start to plant the seed in people's head that the person you could be protecting is you?
I think planting the seed is important, and I think there's also a strong force for self-denial, and we need to recognize that. And I know in a lot of the research that we've been doing and reports we've been doing on the harms of the way firearms can be portrayed through social media influencers and how those are reaching kids. When we talk to parents about that, their thing is, my kid would see that as a joke. I'm more worried about the other kids. So again, I think it's about meeting people where they are. If people are going to be in denial of themselves or perhaps even their own child's needs at times, there's nothing wrong if you're seeing that someone else needs help, getting them the help, or as long as it's doing the right thing, I'm less concerned about that. That's just my take. So.
At AFSP, one of our mottos is to create a culture that's smart about mental health. And so in a lot of our programs, we'll frame it as, whether it's you or someone else, here's something you can do. But also giving, a lot of what we talk about is giving people the tools to have a conversation with someone that they might be worried about. And that's all part of this creating a culture that's smart about mental health, that people understand, and it's really often the self-stigma. This survey that we did, if you go to suicidepreventionnow.org, most people in the United States see getting help for mental health as a sign of strength. Yet if you go to the individual and say, well, what is it? Would you go? And they're like, well, I don't know. maybe people are going to think I'm weak. And so we're changing the culture, whether it's you or someone else, is the way that I think it's important to frame.
And the only other thing I would add is a lot of times when families that I speak to are reluctant to think about this as a broad safety measure, all kind of harken back to when my kids were very young and the pediatrician advised us to put sort of safety locks on our cabs in the kitchen. So again, kind of building that into the system or the water, if you will, kind of like fluoride, that's just general good home safety. Like normalizing that before it becomes something much more daunting. So trying to create systems that normalize that would be my hope anyway.
Thank you.
Other questions or comments of the panelists?
It's the awkward moment where everyone's looking around at each other.
We've stunned them into silence.
Well, if not, do each of you want to make a last comment as we go off into the next break, I guess?
Sure, I'll start off in just, I guess, a plea. So one of the things, from a Sandy Hook Promise perspective, we've scaled across the country, and we're very focused on and cognizant of the fact that every community is different. And what, whether it's the demographics, some of the data that was shared earlier, we do a lot of learning projects to study, like, what does it mean to go with a partner to co-create curriculum? What does it mean to co-create with youth? What does it mean to study the way different communities might respond to, and what can we learn from that in a research environment to then scale elsewhere? So we have learning projects in the Bronx. Like, what does safety mean to a young child there? And how do we co-create curriculum with them? Atlanta, how do we work with community partners that are already in schools? Kentucky, how do we work there? And we have not got a learning project going yet, and have wanted to for quite some time, on what does it really mean in terms of rural, isolated youth with high access to firearms? And there's so many fantastic coalitions that are already in place that it was really energized and inspired to hear about. And I'm thinking, like, what research already exists and what research is still needed? And is there a way to work together again to find that comprehensive, what can we really learn and prove to then take elsewhere? So that would be my plea, please.
I would say similar. If you are a part of a coalition, or if you are a clinician at a mental health clinic or something like that, to do what you can related to either educating yourself on firearms if you're providing, clinical care, to be able to ask your patients about it. It's too important not to do anything about. And, that Surgeon General report, I would just encourage you to read it and just ask yourself, does this represent the proportion of firearm deaths related to, the mass shootings or suicide or homicide? And if there's any way in your community you can change the conversation so that you can begin to bridge gaps to educate firearm owners on the things they can do to keep themselves and their families safe, storing firearms securely. There's plenty of resources that are available that are almost always free. So take advantage of them. And you have so many partners in this room to do that. But it's too important to just say, oh, that's nice. Maybe later. Yeah. Take action now.
Thank you both. And I think maybe we'll just thank Ryan and Nicole, and then I'll turn it over to Karen. Thank you.